other diagnosis, of course, more commonly known in the community is sleep apnea. Simply means that the airway is closed, an open airway versus a totally closed airway versus partially closed airway. So totally closed airway is called apnea, like not no air goes in and out, so no breathing. A means no, P means breathing, so no breathing. And hypopnea means partial air is going in, so partial closure of the airway. So you are partially breathing basically. So if you need 1 liter of air oxygen in every minute, you're probably getting, let's say, 60% of that or 50% of that or 10% of it, depending on how much closure it is there. And these two combined together to call apneas and hypopneas. I measure all that in the night in the sleep study, and we come out with this number called apnea hypopnea index. Means how many apneas and hypopneas you had in each hour of your sleep in the night. That's what the whole sleep study. So that's the purpose of doing a sleep study. So people who have, if we suspect that sleep apnea is present, is one of the important features of having some hypersomnia or excessive daytime sleepiness, then we perform a sleep study. And sleep study is done in the lab. That's a lab-based sleep study we call that. You sleep in the lab. It's a bedroom, and we put all those wires, the multiple wires on the head, which we try to measure your brain waves or to see actually which part of sleep, which stage of sleep you were in, deep sleep stage or REM sleep stage, and that's the only way to know that. Then the next step is the eye waves, the chin waves, the chest belts, abdomen belts, and the leg belts. So basically, we put about 16 different channels of data, and we record that all night long, and we draw comparisons out of each of these as to see how, when you had this arousal, when you were waking up that time for a few seconds, did you have a leg movement at that time, or did you have a breathing episode at the time, or none of these at the time? So we put all those associations together and we come out with a report, and that's called sleep report. With that, the most important parameter for sleep apnea, of course, is to have that number AHI, apnea hypopnea index. And if it's more than 5, that means you have sleep apnea. And I think sleep apnea simply means that you're waking up that many times because of closure of airway. Now think about a situation. When I choke you, and if somebody chokes us, it leads to what would you be doing at that time? The whole body goes into the fighting mode, and that fighting mode affects the lungs, the heart, the brain, and every part of the body, and that leads to disease status eventually. That's why we have so many sleep apnea, so many patients with all these maladies and pathologies who have sleep apnea as a core problem. So CPAP machine helps with that.
Wonderful. Are there 60 to 70 different kinds of sleep disorders? Is that it, doctor?
38 different sleep disorders according to the ASM criteria.
Interesting. Okay. We have a question from Baljit Singh. He wants to know about sleep apnea. He says if you have sleep apnea and you can only use the machine for 3 hours because you cannot sleep after that, so how can you increase the time using the machine?
Wow. Okay, Baljit. So basically, thank you for the question. The compliance of CPAP usage all over the nation is about 52%. But in our lab, we can proudly say that we have compliance of about 85% in our office. And the reason being, I think it's as long as you understand as to what the machine does in improving, how does it work, and if we can address those problems as to what you're experiencing. Maybe the mask is not correctly fitting. Maybe you're not mentally prepared. Maybe the pressure is too high or pressure is too low. So essentially, if the pressure is not good, the mask fitting is not correct, it's too loose, too much leaky. Maybe you didn't sleep enough in the morning. In the night, you don't sleep that much, I guess. So there are many of these things, factors. There's a sleep history we take in examination, and we try to cater to the program to each individual patient. So I think we need to address each of these, look into each of these separately and see if I can increase your number of hours in the night.
Great. And now, doctor, we have a question from Rajiv Puranik who wants to know, is there any guidance on travel jet lag?
Great question. So, Rajiv, I'm assuming you travel across different countries, or maybe is in the US itself. Well, so traveling in jet is a whole different circadian rhythm. Again, it boils down to the same thing. So, in the circadian rhythm problems, we have advanced sleep phase, delayed sleep phase, jet lag disorder, shift phase disorder, and all that. So, in the jet lag thing, if people who travel too frequently, let's say if I travel from here to New York, 3 hours is easy to control, but more than 3 hours, you need to prepare for that, and that's where the melatonin helps tremendously. So those, let's say if I go to Europe, I lose 8 hours in advance sleep phase. So I will have to, if I go to bed here at 10 o'clock in the night, I'm a very good man. I go to bed at 10, I wake up at 6, and I follow all instructions what my sleep doctor gave it to me. But when I go to Europe, my sleep thing is going to be 8 hours earlier. So we have to plan for that later. Either you work 3, 4 days in advance, plan for it, and you work 2 hours and sleep 2 hours later, depending on where you're traveling, east or west. So if you plan to go to Europe, it will be advanced. So basically, when we want to go to bed, maybe at 7 o'clock for a couple of days, and maybe 5 o'clock a couple of days to get into that mode when we go there, so we can sleep fine there. And at this time, the melatonin helps in this. Exposure to light, bright light, when you wake up in the morning, and not exposing yourself to light in the evening will help in this situation. So again, it can be tailored to where you're going, the how we can expose you to light, or how much melatonin you should take and what time. We can tailor the program to each person's recommendation.
Okay. Now we have Parveen Gupta, and she wants to know, is doing light yoga within 3 hours of sleep okay?
Yes, of course. Light yoga, Tai Chi, they all been noted to be helpful um, for inducing good sleep and improving the quality of sleep. There's a study which actually got published about 3 years ago. It showed that Tai Chi and meditation and cognitive behavioral therapy. They compared three groups of people with insomnia who had difficulty initiating sleep or difficulty maintaining sleep, and they found that Tai Chi was almost as equal to CBT, which is the gold standard, cognitive behavioral therapy, which is a biofeedback, negative and positive. So yes, to answer your question, light yoga is always helpful.
Great. And then we have Adolfo Velasquez. He wants to know, do you know of long effects of what's that, mirtazapine or Remeron treatment for anxiety and a sleep aid?
So we generally give mirtazapine for people who have additional issues, psychiatric issues like maybe depression, and we don't see much um, problem. But I would still recommend that you get a sleep apnea checked out just in case and rule it out. If you have sleep apnea, I would rather treat that first than keep you on medicine.
And then Tom Kotlarek wants to know, how does meditation benefit sleep?
It relaxes the body, and it creates a harmony between all those neurotransmitters I talked about in the brain. It also relaxes your muscles and induces sleep induces the quality of sleep, improves the quality of sleep in general.
Do you have a special mantra in mind, doctor?
Sleep well.
Great. So, I mean, I guess we're coming to the more or less the end of our talk, and we had a wonderful talk from you, and we learned the new ways of handling our sleep, which is the most important thing. And as you know, from ancient scriptures, there are three important things in life: eating well. If you don't feel hungry, you don't feel sleepy, and you don't feel active, I don't think you're really living. So you're like a zombie. So you have told us one important aspect of it, which under which we can prevent ourselves from getting any chronic illnesses if we sleep well. And I would like you to just say some last minute tips as to what people should really be doing so that they can improve their life. So basically, if they're having sleep issues, then they know where to go. You must go visit Dr. Sanjay Agarwal, and he will find out whether you what you're suffering from, and maybe take your what is a polysomnography or a polysomnogram to find out at which stage you are lacking in the sleep. But if you are more or less normal and sometimes you don't sleep so well, or you're having some stress related issues, obviously he's recommended meditation and restfulness, and why you should use the bed only for two activities versus others. But the most important thing that I think, if you could tell them, is what they could do in their daily lives so that they can improve their sleep and not have to see a specialist.
Yeah, you're trying to close my shop. Fine.
That was
Yes,
just a
no,
joke.
that's
Okay.
good though. I think keeping everybody healthy is very important, and I think you nailed it. Amy. I think the exercise, sleep, and eating healthy. These are three tridents of the stool. So health. So as essentially, I think to summarize one more time, take home point. I think sleep is not optional. Do not think that you can skimp on sleep. healthy sleep is very important. Sleep. Try to get at least 7-8 hours sleep on a weekday. Try to keep your sleep habits regular. Very important. So going to bed at the same time and waking up at the same time. Try to avoid alcohol at least 3-4 hours prior to bedtime. If you can not drink alcohol, great. If you can avoid it at least 3-4 hours before bedtime, that'd be good. And try to avoid caffeine in the afternoons. Even though we hear all around, oh, I chai pee ke sone mein maza aata hai, but that's not good. It also, actually, caffeine does affect your quality of sleep for sure in the night. So don't take sleep. Don't think sleep is optional. Sleep in a consistent fashion, and try not to take naps in daytime. That's all. That's all good enough.
Great, Doctor. And I hope all the other participants have learned a lot of important things from the specialist. And when I said that, you know what, I think life is all about, and I think we doctors are teachers. So our basic duty is to make sure that people who are, can help themselves, should help themselves. And the people that we are dealing with today in our talk and who have attended our sessions are all harbingers of change, and they are trying to get certified and become their own health advocates. And I would like to learn from the best, which you are, Doctor. So, with that, I would like the other participants, if they have any more questions for the doctor, and they can still ask, we still have some time. And he's right here. It's very difficult to get hold of him, let me tell you. We have to chase him down. He's very, very busy, and he is helping a lot of people. So if you do have some problems, do not hesitate to go to him. As you can see, he's extremely friendly and he's very patient, and he will listen to you and your problems and maybe guide you in the right direction. So with that, anyone else has any questions? Otherwise, we can wrap up the session with thanking Dr. Sanjay Agarwal for taking out time from his busy schedule to come and help us all get better sleep. And if you're not getting better sleep, okay, for more than maybe a week, then it's time to visit Dr. Sanjay Agarwal and not rely on Google, and try and understand. And he can tell us at which stage we are, and so he can help us get back on track.
Thank you all for participating. Thank you all for being mindful of the wellness and taking the initiative. Sleep is important, as I mentioned. So is exercise, and so is mental well-being, and so is healthy eating.